Hey, good morning. Patricia Murphy here. It's Saturday. This is Seattle Now. Today, we're bringing you the best from the KUOW Newsroom. King County's health department has published innovative and educational comic strips about public health issues for more than 15 years. The county hires local comics artists to tackle issues like long-term COVID, preparing for a natural disaster, and how to deal with a failing septic system. Kyle Norris talked to Meredith Li-Vollmer, the heartbeat behind this project, about comic books, bringing excitement to public health messaging, and how they reach people in more than 20 different languages. Here's Kyle.
Meredith Li-Vollmer works for the King County Health Department in communications. At the moment, she's wandering around the giant free health clinic that happens each spring at Seattle Center. Meredith is carrying her sketchbook and her favorite pencil because she's not looking for healthcare. She's looking for someone to draw. She finds a potential subject in Dr. Sati Maiti.
How did you get involved with the clinic?
Yeah, so I am an optometrist, so I practice here in Seattle, and I've always been
Sati stands next to a machine that looks like a steampunk mask with all these lenses and knobs that she uses to fine-tune people's eyeglass prescriptions. Meredith cracks open her notebook.
I'm going to just do a real quick sketch.
And with a few strokes of her pencil, she turns Sati into a comic character. And the sketch really looks like Sati, even though Meredith downplays her talent.
I'm not such a fantastic artist that people be like, oh my gosh, that's my doctor.
No problem. I'm a visual artist too, so I get it.
What do you do?
I draw and paint.
Okay, I love a good twist, that the doctor is also an artist. The two of them then dive into a conversation about stylish eyeglasses. Now, I want to jump back in time, because all of this started because Meredith loves to draw.
When I was really little, I used to draw comics with my brother. We created our own characters, and we would draw on these big rolls of paper. And so we would make our own newspapers, including the comic strips.
In junior high, she kept drawing and branched into different areas. She was inspired by a new thing called MTV and designed her own album covers for fake bands. Think grid lines, pastels, and checkerboard. But Meredith stopped drawing as a teenager.
Because I had a high school art teacher who was really discouraging. And I thought, well, I guess this is not for me.
Decades later, in her 30s, Meredith found her way to comics. This was around 2007. She'd read a book by Scott McCloud called Understanding Comics, and it's about how effectively comics can be used to explain complicated topics. And Meredith wanted to try this at her job. The county wanted to craft some material about how to prepare for a global pandemic, but few people were paying attention. Meredith thought that telling a story about a historical pandemic in a comic form might entice people to read about it. So she wrote a story about the 1918 influenza pandemic, and a local artist illustrated it. That story kicked off the health department's embrace of comics as a way to deliver health information. Soon Meredith began to meet other comic artists, and they nudged her to start drawing her own health comics.
They're very welcoming, and I'm a middle-aged public health worker, and, there are these artists who are much more established in what they do, and yet, they told me, you should own it. You're a comics artist.
That was more than 15 years ago. Since then, Meredith has helped publish many stories for the health department about long-term COVID and gun safety and how to prepare for a natural disaster, all in the form of comic strips, which the county posts online and publishes in books. So what are the upsides of using comics in this way? Well, as Meredith says, public health information can sometimes make your eyes glaze over.
Public health issues are often very complex. And they can feel very wonky, they can feel very dry. But I feel like all public health issues have stories behind them, and they are all stories about people.
She's currently working on a strip that she says seems like a horrible idea for a comic, septic systems. But Meredith's making it captivating by focusing on a fictional family whose lives get turned upside down when their septic system fails.
The kids are freaking out because, the toilet's backing up.
Instead of presenting a boatload of data, Meredith highlights personal stories. She says that's where she finds the power to engage with folks.
Especially post-COVID, people don't want to think about public health issues a lot of the time. They're burned out. I get it. I don't blame them. But if we can help evoke some sort of emotion about an issue so that people will read on, will want to learn more, will want to talk about it.
She wants these comics to start conversations about how we can care for everyone's health. Another benefit of the comics, the simple and clear style of the art helps the county reach more non-native English speakers. Little story here. Way back when Meredith started this project more than 15 years ago, her bosses were not on board at first. They misunderstood her concept and thought she wanted to draw superheroes or comics for little kids. Around that same time, Meredith had been doing outreach to different immigrant communities, asking them for feedback about how the health department could do a better job communicating.
They said, we want more visual things. We want more illustrated things. And I said, well, what about comics? Yes. And once I had that from the community saying, the community wants this, that really helped me be able to go ahead with that project.
Some of the county's comic books have been translated into dozens of languages, including Arabic, Spanish, Korean, and Ukrainian. These stories have been a huge hit. That's what Julia Colson says. Julia is the founder of the Free Health Clinic, where Meredith was sketching people earlier. Julia says when she gives presentations to bigwigs to drum up support for the clinic, she hands them the comic books to read. But she's got to be careful about when she passes them out, because these comic stories may be too compelling.
When I take these comics and I'm talking to potential funders or other stakeholders or policymakers, I've found that I actually have to give this to them after I speak with them, because if I give it to before, they get so engrossed in the comics that they don't listen to what I say.
Julia says the comics have helped convince people in power to support the clinic. And now that the clinic is about to celebrate its 10th year, Meredith is making a comic strip about the anniversary. Sati, the eye doctor she sketched earlier, makes it into one of the panels. Her character wears cherry red glasses and a big smile as she gives a patient an eye exam and explains why she volunteers at the clinic. Meredith is surprised that she gets to draw as part of her job.
I never expected to do comics, never expected to be part of a comics community. It's just one of those unexpected turns in life that I'm really grateful for.
Meredith says circling back to something creative she loved to do as a child is pretty great. And if Meredith's artistic journey were a comic story, that teacher who criticized her artwork would be a single panel, while the art Meredith has gone on to make has filled entire books. I'm Kyle Norris.
Thanks for listening to Seattle Now. Our production team includes Caroline Chamberlain Gomez, Andy Hurst, Bon Jones, Brooklyn Jamerson Flowers, Paige Browning, and Shane Malin. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Patricia Murphy. See you soon.